not at all whatsoever. I ain't got time for that. I'm a professional. Welcome to Daycare Chronicles 101, and I am your host, Miss Tanya. Listen, everyone, this episode is going to be about COVID-19, coronavirus, whatever you want to call it, and the impact that it is having on childcare, on your providers, on the families and the children. I have a physician on the line right now to help us with some information that will possibly help us reduce the risk of COVID coming into our facilities, but also enlighten us on what's really happening and why the numbers in California are over 10,500 in one single day. Doctor?
Well, one of the reasons why we've seen such a rapid rise in the number of daily COVID cases has been due to the fact that people have let their guard down. We have been in this pandemic for many months now, and we have the holiday season among us, and we had Halloween, and then we had Thanksgiving, and we have Christmas, and we have New Year's coming up. Mm-hmm. And right after Thanksgiving, you could see a rapid rise as a reflection of people getting together and not social distancing and not wearing their mask. And if this continues, we will continue to see the cases rise even higher. Statisticians predict that Christmas and New Year's, that will be around the time where we see our highest number of cases because we have let our guard down and we've let COVID into our home and it is affecting our families.
Wow. I agree about the Thanksgiving and the holidays. I encourage my clients not to, get together with family and look at what we're seeing now in the news. The numbers don't lie. The numbers don't lie. Can you share the act of kindness that you shared with me, with my audience?
Recently there was a family that was on CNN, and it was actually a nurse, and she was in the intensive care unit hospitalized, and they were recording her from her hospital bed. She lives in her home with her husband, her 2 children, and her parents. And her mother did a random act of kindness of taking her friend to the doctor because her friend stated that she had a cold and needed to see a physician. Well, that cold likely ended up being COVID, and her mother caught COVID and brought it home, and everyone in the house was affected by COVID. Unfortunately, everyone recovered except for the nurse's father, who passed away from COVID. And this one random act of kindness in which she thought she was just taking her friend to the doctor and for a simple cold ended up ending someone's life.
Wow.
And she's currently in the ICU fighting for her life.
The grandmother.
The nurse.
Oh, the nurse. Oh, my goodness. Wow. Well, I want to thank you for your time. Thank you for sharing this story with us because it's real. And how many of us don't do acts of kindness, especially during this time? So I want to thank you so much. We'll finish talking later. I appreciate you. Now back to my listeners. Listen, everyone, this is so real. And as providers, we have a difficult decision to make every day that we open our doors. We know what we're doing, but we don't know what our clients are doing. We don't know what their parents are doing. We don't know where the children are on the weekends. Are they with their parents? Are they with other people? Are they with their grandparents? I mean, there's just so many what ifs for us as providers. And for me, we have the precautions set in place and all of that. But if you have someone that's not following the state guidelines, public health guidelines, then we're all at risk. As providers, we cannot guarantee our clients that COVID is not gonna come into the facility. There's a great possibility that it will, especially when we're getting over 10,000 new cases in LA County a day. That's just astronomical. I mean, I'm just trying to even just picture that in my head. That many people a day. We are essential workers, as we're told. We're not getting essential pay for opening up our homes, having our daycares open. We are cleaning more. We are disinfecting more. We're sanitizing more. We have eliminated some of the activities that the children are allowed to do. We have taken out some of the toys that they are used to playing with because of COVID. Maybe it's we don't do the stuffed animals anymore, the soft toys, things like that. We're doing things that are easy to clean, that are pretty hard, whatnot, easy to sanitize. I feel like as a provider that to a certain extent, our parents have a false sense of security when it comes to coronavirus because of how we receive our children in the mornings. We're always happy as providers. We do our protocol. We're taking temperatures. We're sanitizing hands. We're not allowing the parents in. I switch out shoes. They have shoes that they leave at the daycare for the week. And then they have shoes that they leave on the porch. And so I feel like the parents are like, okay, bye. Have a great day. See you later. And once we close that door, it's like Fort Knox up in daycare. It begins. The cycle begins again with the cleaning, the sanitizing, the trying to keep them social distance, the mask wearing for those that are able to wear masks. It's just a whole lot. On top of, we still have our regular routine that we've been doing with the children. We still have our curriculum, our circle time, our outside time. And, licensing is saying, more outside time, which is a good thing for the children. They're not as close when they're outside. Having an indoor-outdoor classroom is a really, really good thing to have. If you don't have one, please send me a email or a DM to my Instagram page, Daycare Chronicles 101. You can hit me up on TikTok or my YouTube channel or my Facebook page, Daycare Chronicles 101. If you need any assistance, please let me know. I am here to help. And you can always go to my website, daycarechronicles101.com. I am here for the provider. I am a provider that is still providing care. So I get it. I know what we go through on a daily basis. These clients just don't get it. I feel like they just don't get it. As much as I talk to my clients about it, the COVID-19 protocols that I have in place, I just feel like they're like, okay, Miss Tanya, okay. When at the end of the day, everything that I'm saying, everything that I'm doing, I'm getting advice from doctors, I'm following the public health licensing, their protocols, the CDC protocols. If you are a provider that does not have a COVID-19 policy in place, please go to my website, subscribe, and send me a message, and I will get back to you. Or again, you can hit me up on TikTok or on Instagram or Facebook or YouTube. But I really need you all to put something in place. Even though you may not have anything in place now, this is your business. You can go in and redo anything at any time to cover yourself. You run your business. This is your baby. So go in there tonight, change your policies so that you are covered. Let your clients know what's expected of them, the do's and the don'ts. I have created a policy that I have, and if you would like to have a copy of the policy, you can go to my website, and for a small fee, I will email it to you. Now, this is just what I created. You can use it or you can edit it. Whatever you want to do with it, you can do that. But you need to have something in place. So just because you don't have something in place already, it's not too late. You can do an addendum or you can just add this in there. I have a COVID-19 action plan. I have a COVID-19 rules and regulations. I have a possible COVID-19 case policy in place. I have these things in place. It seems like every time something else happens, then there's a new policy or a rule that needs to be put in place. COVID is no different. This is all new to us and we're all learning about it. So you can change your policies, your rules, your regulations at any time you want to. This is your business. Have your clients sign the agreement saying that they agree with it, they read it, and have them date it. It becomes a part of your contract. Do not allow you not having something in place to cause a negative effect on your business. So put something in place. Please put something in place. As providers, we are buying things out of the trunk of people's cars because we can't get the essential supplies that we need. Parents just don't know all that providers go through to make sure that we are staying COVID safe, to make sure that we have the essential supplies that we need. And for those parents that do get it, and you are picking up things and donating them to the daycare and giving them to your provider, thank you, thank you, thank you so much. You have no idea how much that means to us, especially during this time of need. I have been speaking with providers all over the world. And when I tell you that some of the states and some of the child care centers really, really, really don't get it. They just don't get it. I have employees DMing me, telling me that there's a child that tests positive and the daycare is still allowing them to come. This isn't after the 14 days. This is during the 14-day quarantine that they should be on. They're saying that if they get COVID and they're in certain states or whatnot, that their job still requires them to come or they will get fired. How crazy is that? This is why we're in a state of emergency where we're at. Wear your damn mask. Wash your hands. Social distance. Stop giving parties. Stop giving parties. Stop going to parties. Stop getting on airplanes, flying places. Let us get this under control. It's not under control. And you got to think about it. When someone dies from COVID, that's someone's parent, grandparent. It could be someone's child, someone's loved one, someone's family member. It affects so many people. So we can't be selfish with this pandemic. We must get it together. What if it was your mother, your father, your child, your sister, your brother? Would you act differently? We must just get it together. This is so emotional for me because as a mother, as a grandmother, as a sister, as a provider, as a wife, this is scary. And the fact that we open our homes every day. These are our homes. We just had the doctor on the phone. Well, the doctor goes to the hospital and then comes home. So COVID is at the hospital and then they come home. With us, we're in our homes. So COVID can come right into our homes. And we're all at risk about it. There have been other daycare workers that have sent me messages saying, Miss Tanya, we really appreciate the fact that you're doing what you do, but how do we get our boss to implement those things without losing our job? Now, how sad is that? That you're so afraid to say something because your boss isn't going to receive it? When these are not your guidelines, not my guidelines, these are the CDC, public health, licensing guidelines. The fact that someone would be so concerned about the money opposed to a life is really sad. We all need money to survive. I get that. I know that. But at the end of the day, this is a crazy, crazy, crazy pandemic. And it's doing things, it affects different people different ways. And so I found out that from the doctor that was on a call with us, that you can do your 14-day quarantine. You have COVID, you do your 14-day quarantine. That you can still test positive for months after being quarantined, after your 14 days is up. You can still test positive. And that's something that I didn't know. This virus is something else. It definitely is. And as providers, we put our clients on a 14-day quarantine. You say, okay, you need to bring me a negative test. Well, what do? if they come back and their test is still positive. Or as for a child who has done their 14-day quarantine, they're not showing any symptoms, no fever, no nothing. Technically, you don't even require them to go take another test because they've done their 14-day quarantine. There's no symptoms there. You can still have no symptoms, go get tested, and still be positive. What do you do as a provider? What do you do? We're doing the best that we can every day. We are not physicians. We're not doctors. However, we are providers. We are mothers. We are caregivers, and we must protect ourselves and the children in our facilities. For the parents who say, well, I don't want to pay daycare if my child, has to quarantine or whatnot. It depends on what your contract says. If your contract states that even during a pandemic or anything, that daycare still needs to be paid, then daycare still needs to be paid. Update your contracts, providers. Please update your contracts to include a national pandemic, a global pandemic, coronavirus. Make sure that you have something in place to protect yourself. It's unfortunate, all of the businesses that have to close. However, we have an additional 10,500 cases today, Sunday, that have been reported so far. So tomorrow, Monday, to wake up in the morning and see what the numbers are again. And our stay-at-home order goes into effect tonight. And I've had providers calling me saying, well, Ms. Tanya, what are you going to do? Are you going to just allow your clients to come? Are you just keeping essential workers clients? And I'll say this, a lot of things get lost in translation through text message. So what I have started to do is to send my clients a video message of me with the message that I want them to have. That way, you can see me, you can see my facial expressions, you can hear my tone. You're not able to put in what you think I'm saying, how I'm saying it, because this is visual. This is not just through text. So the translation can't get lost because this is a visual of me. This is a video. So I'm concerned. This is coming from a place of love. Whether you receive it or not, that's up to you. That's just something that I've started to do, is more of a video text. I'm sending everyone a video of me with the message. I am asking my clients, unless you are an essential worker, then your children need to stay at home during this time. For the simple fact that the numbers are so high in California, and we are taking a risk every single day that if your child does not need to come to daycare, why would you send them? Do you understand what a pandemic is? I'm just at a loss sometimes. And, I feel like crying at times and I have wept because I feel like the clients just really don't get it. And not only the clients, the world. The world is just not getting it. What is happening here? So I just want to say that I plan to do a Zoom session soon. And I pray that, those that are listening will be a part of the Zoom so that I can hear back from you all and hear what you're doing or what your needs may be. Again, go to daycarechronicles101.com. Subscribe, send me a message. I'll respond to you personally and try to help you as best that I can. Any questions that you may have, you can go to the group Facebook page, Daycare Chronicles 101. You can post a question there. Providers will chime in and answer it. That's just a wonderful group to have right now because we need that support system. Daycare is such a solitary career sometimes, and you don't always have someone to talk to, someone that you can call to get advice or to bounce ideas off of. All I want to say is stay safe. Don't limit your protocol. Keep doing what you're doing. Make sure that, even throughout the day now that we're checking the children, for their temperatures or whatnot, just trying to make sure, because sometimes, and y'all know I'm right, Parents will give their children some Tylenol or some Motrin in the morning before they come to daycare, and that will wear off by noon, and then here comes the fever. Over 100 degrees, 102, 103, 104. Right now, it's difficult for us as providers because we're still in the midst of common cold season, flu season. Right now, you can't even differentiate what's what. If a child starts coughing, you're like, oh, wait a minute, let me call your mama. How long you been coughing? Oh, no. If a child sneezes, we're like, let me call your mama. You know, if a child gets a runny nose, oh, no, let me get your mama here now. These are just regular things that happen. And due to COVID, our senses are heightened now. Children are still going to get colds. They're still going to get runny nose. They still may get a cough. You know, asthma may flare up. And parents have to understand that we're in the middle of a pandemic. And we want your children here. This is why we do what we do. However, at this day and time, we have to be careful because we just don't know. And it's so frustrating for providers because we just don't know. But we're trying to stay as safe as can be. I tell my clients, give your children vitamins, boost their immune systems, feed them healthy. And with that being said, I'm going to talk about a nice, healthy meal. I have just discovered, and I know maybe I'm late on this, but the Instapot. The Instapot, I borrowed it from my daughter because I wanted to try it out before I purchased it. I have so many kitchen gadgets. That Instapot cooked chili, fresh chili beans, the small red beans, made chili in 45 minutes. When I tell you I cannot wait till my children get here tomorrow, they're going to have chili. They're going to have roasted broccoli. I am going to make them some fresh homemade whole wheat muffins. They're going to have a fruit salad. It is just going to be amazing. The Instapot is the real deal. I am so excited about this Instapot because as providers, we spend so much time in the kitchen. I had no idea about the Instapot. I love the Instapot. Let me tell you, I went and purchased one today at Target. They have them on sale. So I went and got one today and I'm so excited about it. The Instapot will make your life so much easier. And I'm not getting paid to say anything about the Instapot. I just love the product. So chili beans, roasted broccoli. We're going to do a fruit salad. I'm going to make some homemade whole wheat muffins. Oh my goodness. That is lunch for tomorrow. That sounds so yummy to me. And I am so excited. You know, I always do a shout out to a toy company. Learning Resources. OMG. Learning Resources is an amazing company that has amazing products. I have done some toy reviews that I will be posting on my YouTube channel, Daycare Chronicles 101, of some of their products. Providers. It's so realistic, so lifelike, easy to clean, easy to sanitize. Just about everything that I did a review on, you can wash it in the kitchen sink. It's heavy duty plastic. It's so inviting, so engaging, and I can't wait to post the videos on my Instagram page, my TikTok page, and my YouTube channel of the children playing with these items. Learning Resources, you got it. Let me tell you, I am in love. I am in love, and I cannot wait for my children to get here tomorrow. I'm going to have everything set up for them and providers. During this pandemic, it's good to switch things up for the children. We don't know what they're dealing with at home. They're not able to go outside. They're not able to visit with friends. Well, they shouldn't be. So when they come to daycare, I have just tried to switch things up for them, and they're just having so much fun. Being outside with all the different items that I've been purchasing for them. If you go to my pages, you can see them. If you need any help setting up an indoor-outdoor classroom, setting up your daycare room, your playroom, anything, send me a DM, hit me up on my website, daycarechronicles101.com, or, send me a message on IG. I just want to say that I want us all to stay safe. I want us all to stay COVID-free. And just remember that if you do your part, if everyone does their part, then we can be successful at eliminating COVID-19, coronavirus, whatever you want to call it. There are vaccines coming out. That's your decision, whatever you choose to do. I just want to say that we need to keep these practices and these protocols in place so that when the children come into our homes, that we make sure that we're doing the best that we can do as providers. Remember, if you don't want to be a chronicle, don't do it.